Another lesson, another drug. Hey there everyone, welcome again to our video, and for today's video, we will be talking about the drug Dexlansoprazole. Let's get on to the video. The generic name of the drug is Dexlansoprazole. The brand names are Dexilant, Capidex, and Dexilansolutab. Its chemical name is C16H14F3N302S.
So its drug classification. So for its therapeutic classification, proton pump inhibitors or PPIs. So for the pharmacology classification, Dexlansoprazole is a proton pump inhibitor or known as PPI and is included in the drug class of anti-secretory compounds, and it blocks the final step of gastric acid secretion by specific inhibition of the H plus K plus ATPase at the secretory surface of the parietal cells on gastric mucosa. As for its pregnancy category, it is under the pregnancy category B. There are no adequate and well-controlled studies with Dexlansoprazole in pregnant women. There were no adverse fetal effects in animal reproduction studies of Dexlansoprazole in rabbits.
The mechanism of action of the drug. Dexlansoprazole is a proton pump inhibitor that suppresses gastric acid secretion by gastric parietal cells. It is the re-enantiomer of lansoprazole and represents greater than 80% of the circulating drug after oral administration of lansoprazole. Dexlansoprazole inhibits the H plus, K plus, ATPase enzyme required for gastric acid pump activation, thereby irreversibly blocking the final step of acid output from the parietal cells. A significant increase in gastric pH and decrease in basal acid output follow oral administration. Dexlansoprazole capsules contain two types of granules, each of which dissolve at a different pH. This unique dual delayed release formulation allows for two distinct phases of drug release. The second phase of drug release purportedly inhibits proton pumps that were initially uninhibited or that were reactivated after the first phase of H plus, K plus ATPase enzyme inhibition. Dexlansoprazole exerts an inhibitory effect on gastric acid for at least 24 hours, which allows a once-daily dosing schedule. Similar to lansoprazole is hypergastrenemia can occur during dexlansoprazole therapy. Mean fasting gastric concentration increases from baseline during dexlansoprazole treatment. Patients treated for more than 6 months experienced a mean serum gastrin level increase during the first 3 months of treatment. Increases level off and were stable for the remainder of the 6-month treatment period. 1 month after treatment discontinuation, serum gastrin concentration returned to pre-treatment levels. Although prolonged hypergastrenemia has been associated with gastric tumors, long-term studies of proton pump inhibitors have not revealed an increased development of tumors, which was an initial concern in animal models.
As for its pharmacokinetics, for absorption after oral administration of Dexilant of 30 mg or 60 mg to healthy subjects as symptomatic GERD patients, mean Cmax and AUC values of dexlansoprazole increased approximately dose proportionally. As for its distribution, plasma protein binding of dexlansoprazole ranged from 96.1% to 98.8% in healthy subjects and was independent of concentration from 0.01 to 20 mcg per ml. The apparent volume of distribution after multiple doses in symptomatic GERD patients was 40.3 liters. As for its metabolism, dexlansoprazole is extensively metabolized in the liver by oxidation, reduction, and subsequent formation of sulfate. Glucuronide and glutathione conjugates to inactive metabolites. Oxidative metabolites are formed by the cytochrome P450. Enzyme system including hydrosylation mainly by CYP2C19 and oxidation to the sulfone by CYP3A4. And as for its excretion, following the administration of Dexelant, no unchanged dexlansoprazole is excreted in urine. Following the administration of dexlansoprazole to 6 healthy male subjects, approximately 50.7% of the administered radioactivity was excreted in urine and 47.6% in feces. Apparent clearance in healthy subjects was 11.4 to 11.6 liters per hour, respectively, after 5 days of 30 or 60 milligrams once daily administration. Dexlansoprazole is administered orally. Plasma protein binding of dexlansoprazole ranges from 96.1% to 98.8% in healthy subjects. It is not known whether dexlansoprazole is excreted in human milk. However, race-mate lansoprazole is excreted into animal breast milk and possibly into human breast milk. Hepatic metabolism of dexlansoprazole is extensive. Oxidative metabolites are formed by the cytochrome P450 CYP enzyme system. Hydrosylation occurs mainly by CYP2C19 and oxidation of CYP3A4. The plasma elimination half-life, which is approximately 1 to 2 hours in adults, is not related to the gastric anti-secretory effects, which last more than 24 hours. No unchanged dexlansoprazole is excreted in the urine. Affected cytochrome P450 or CYP450 enzymes and drug transporters CYP2C19, CYP3A4. Dexlansoprazole is a substrate of the cytochrome P450 system via the CYP2C19 and CYP3A4 isoenzymes. Therefore, drug interactions with agents that may inhibit, induce, or otherwise competitively affect the metabolism of dexlansoprazole are possible.
The drug's indication. Dexlansoprazole is indicated for healing all grades of erosive esophagitis or EE, maintaining and healing of EE and relief of heartburn, and treating heartburn associated with symptomatic non-erosive gastroesophageal reflux disease or GERD.
As for dexlansoprazole's contraindications, dexlansoprazole is contraindicated in patients who have shown dexlansoprazole hypersensitivity. Daily treatment with gastric acid suppressing medications such as dexlansoprazole over a long period of time may lead to malabsorption of cyanocobalamin and vitamin B12 deficiency. It is also contraindicated to patients with hepatic disease, to patients with gastric cancer, to patients who suffer from bone fractures, osteopenia, and osteoporosis. Also in hypomagnesemia, long QT syndrome, persons with diarrhea, pseudomembranous colitis, rebound acid hypersecretion, pregnancy, breastfeeding, laboratory test interference, CYP2C19, poor metabolizer, systemic lupus erythematosus, otherwise known as SLE, also with patients with who are geriatric, and also children, infants, and neonates.
side and adverse effect of the drug. Get emergency medical help if you have signs of an allergic reactions, hives, difficulty of breathing, swelling of face, lips, tongue, or throat, or call your doctor at once if you have. Severe stomach pain, diarrhea that is watery or bloody, a seizure or convulsions, sudden pain or trouble moving your hip, wrist, or back. Kidney problems, urinating more or less than usual, blood in the urine, swelling, rapid weight gain. Low magnesium or dizziness, fast or irregular heart rate, tremors or jerking muscle movements, feeling jittery, muscle cramps, muscle spasms in your hands and feet, cough or choking feeling. New or worsening symptoms of lupus, joint pain, and a skin rash on your cheek or arms that worsens in sunlight. Taking dexlansoprazole long-term effect may cause to develop stomach growth called fundic gland polyps. Talk with your doctor about this risk. If you use dexlansoprazole for longer than 3 years, you could have developed a vitamin B12 deficiency. Common side effects may include nausea, vomiting, stomach pain, gas, diarrhea, headache, mouth pain, sore throat, stuffy nose, sinus pain, or other cold symptoms.
Nursing responsibilities before administering dexlansoprazole. So, a nurse should be certain of the identity of the patient before administering a drug and conform this with the wristbands and ask the patient for their name and date of birth, as well as ensure that the patient is not allergic to the drug. The nurse should have a clear knowledge of medication to be administered, which is the dexlansoprazole, its medical use, regular dosage, reported adverse effects, and any specific contraindications or precautions associated with the drug to prevent any untoward complications. The nurse should also be familiar with the treatment plan of the patient and the need for the drug to be administered to the patient, and perform a thorough physical assessment, for example, skin assessment, mental status, abdominal examination, and etc., to establish baseline data before drug therapy begins, to determine effectiveness of therapy and to evaluate for occurrence of any adverse effects associated with drug therapy. The nurse should also consider the dose, the route, and pacing recommended and equate this with their understanding and experience. The nurse should verify the drug's expiry date. Do not give to client who is currently breastfeeding. Heartburn can mimic early symptoms of heart attack. Get emergency medical help if the patient have chest pain that spreads from the jaw or shoulder, and if the patient feels anxious or lightheaded.
Nursing responsibilities during drug administration. Evaluate alertness. Drowsiness may occur and usually disappears with continued therapy following reduction of dosage. Reevaluate usefulness of drug periodically. Monitor responses carefully when beginning therapy so that the dose can be adjusted accordingly. Provide thorough patient teaching to enhance patient knowledge about drug therapy and to promote compliance with the drug regimen. Provide safety measures to prevent injuries. The administration of the drug should be reported immediately in the patient's notes, clearly and accurately, with the nursing signing and printing their name and documenting the date and time the medication was administered. Nursing responsibilities after administration. Monitor patient response to therapy. Monitor for adverse effect. Evaluate patient understanding on drug therapy by asking patient to name the drug, its indication, and adverse effect to watch for. Monitor patient compliance with drug therapy. Inform client to not drive or engage in other potentially hazardous activities until response to drug is not known. Inform client to not drink alcohol and dexlansoprazole at the same time. Consult physician before self-dosing OTC drugs. That's all, and thank you.